Hi, I'm with Amrita Bhowmick from Health Union, and we're going to talk about
Social media and engaging.
Hi, Amrita.
Thanks so much for having me.
It's our pleasure. Amrita, what are 3 ways to leverage social media to help combat social isolation, particularly in a time when so many are struggling with the effects of physical distancing?
Sure. So I think the most important thing to keep in mind is that social media, like most technology, is a tool, and you really want to make sure that you're using the tool versus being used by the tool. For instance, we know that meaningful interactions, such as using social media to connect with friends and family, can really combat loneliness, while less substantial interactions, scrolling through your newsfeed endlessly or doom scrolling, can really have a negative impact on mental health. Similarly, passively engaging, or we often call it lurking, is generally not all that beneficial for your overall health and well-being. But there is one caveat there that if you are a lurker in a group that's really meaningful to you based on the people who are involved or the subject that's being discussed, there are many proven upsides to that. Last but not least, I would say it's important to not fall victim to the design of these tools. Try to make sure you're being mindful and using social media on your time versus getting sucked into those red notification bubbles that can be hard to resist. Similarly, there may be times when you want to consume content, but it makes sense to skip the comments because they're kind of devolving into an unmoderated mess. And I know that these things are difficult to do, but with some practice and discipline, you can definitely get there.
Those are excellent tips. Now let's turn it to how pharma companies and brands can, how they can play a role in alleviating social isolation and loneliness during these times.
Sure. So there are actually a lot of parallels between the two. It ultimately comes down to focusing on quality over quantity. I'm sure you can imagine that people really are just overwhelmed by the amount of noise out there, especially on the internet. And more so than ever, patients are really looking for quality content that is meaningful and useful to them. So ultimately, it comes down to really understanding the challenges that people are facing and finding proactive ways to help them address those challenges in a very relevant way. We know that patients probably aren't looking for direct social support from pharmaceuticals, so a different angle makes the most sense. For instance, providing access to patient support programs or healthcare professionals that can help educate them on how to manage the social and emotional aspects of living with a chronic health condition, especially because we know that these conditions are associated with an increased chance of loneliness and social isolation, all of which can lead to greater negative health outcomes. And patients aren't the only ones that can benefit from this awareness and education. There's plenty of healthcare providers and care partners that could really benefit from it as well.
Amrita, thank you so much for spending a few minutes with us for our one-on-one program.
Thanks so much for having me, Taryn.